Hello everyone, Assalamu alaikum. As a gynecologist, one of the most common problems we face in our gynecological OPDs is a condition called Polycystic Ovarian Syndrome. Now, what exactly is Polycystic Ovarian Syndrome? Polycystic Ovarian Syndrome is one of the commonest hormonal disorder affecting the reproductive age group women and one of the commonest cause of infertility in women. Internet in this era has so much misinformation about Polycystic Ovarian Syndrome, reading which the patients are totally baffled, confused, disturbed, and they're totally lost regarding the symptoms. So, in this platform, I thought I would just discuss a few myths and the misconceptions about Polycystic Ovarian Syndrome and how to debunk it. Let's start with myth number 1. Doctor, I need to have multiple cysts in the ovary to be termed Polycystic Ovarian Syndrome. Incorrect. I would suggest that a person needs to have 2 out of the 3 criteria of Rotterdam's criteria, which is suggestive and a diagnostic feature for Polycystic Ovarian Syndrome. The first criteria being irregular menstruation, suggestive of anovulation or oligo-ovulation. The second criteria being excessive male hormones, male androgen hormones like testosterone, androstenedione, or the symptoms therewith like hirsutism, male pattern of hair loss, acne, and the other androgenic symptoms. The third point is only about the ultrasound criteria, where you need to see multiple cysts in the ovary, in the periphery area of the ovary, which is diagnosed and mentioned by the radiologist. So only having a polycystic ovary is not the feature to term the person as PCOS. Second, myth number 2, I would also get patients telling me that I cannot get pregnant if I have PCOS. This is also incorrect. Many of the many of the patients get pregnant normally without any medications, but there are few people who can come to you with anovulation or irregular ovulation or not adequate ovulation. For those people, we may have to ask them, or we may have to start on fertility medications. Next, I would talk about the myth number 3, in which the patients come and says, I have irregular cycles and hence I have PCOS. No, this is also incorrect. Irregular cycles can be caused by many other conditions like hypothyroidism, stress, other endocrine disorders, and also one of the causes only is Polycystic Ovarian Syndrome. Hence, we have got to do blood investigation to rule out the other disorders before terming the person as Polycystic Ovarian Syndrome. Also, the myth number 4 I have seen is, if you're not looking to be pregnant, then you don't have to worry about Polycystic Ovarian Syndrome. This is also incorrect. Definitely, yes, infertility is one of the portions and one of the important point a person can have of Polycystic Ovarian Syndrome, and once they've completed their family, that does not mean that they don't have any other risk factors. There are multiple long-term sequelae linked to Polycystic Ovarian Syndrome like diabetes, high blood pressure, dyslipidemia, and also psychological disorders like depression, anxiety, and above all, we've also seen endometrial cancer due to endometrial hyperplasia. So another myth I also want to talk to you about was people come to me telling that why don't you get the ovaries removed because the person has Polycystic Ovarian Syndrome. But this cyst is so tiny that this cyst need not be removed. This cyst is treatable by, first of all, going in for a lifestyle modification, by having an adequate exercise and a very good balanced diet, and at the same time trying all methods of reducing weight by going in for cardio and swimming, by regular walking. All these lifestyle modification definitely reduces the chance of getting a PCOS and definitely getting pregnancy or maintaining your regular cycles. There are many more myths and miscommunications or misconceptions in PCOS which I need to touch. Because of the lack of time, I'm not touching everything. I hope this much information has been helpful to you all, and I look forward to presenting more videos regarding Polycystic Ovarian Syndrome. Thank you.